Patients using the public healthcare system in the Eastern Cape still struggle to have their requirements met. This is according to the third edition of the Ritshidze State of Health report, which also reveals a number of critical improvements since the last edition. Ndivhuwo Rambau is the Ritshidze project coordinator and joins me now. Appreciate your time today. Now, the report mentions improvements in certain areas such as reduced waiting times and friendlier staff attitudes. What are the key factors contributing to the positive changes, and how can they be sustained?
So thank you, Hugo, and thank you so much for having us. As you know, Ritshidze is a community-led monitoring initiative where we monitor these facilities and also come up with recommended solutions for facilities, for district departments of health, as well as provincial departments of health. So we feel that as we've been monitoring over the years, there have been certain things that have improved in the facilities, such as the waiting times and a bit of the staff attitudes that we're seeing amongst healthcare providers in the province. However, there are still some pressing issues that need some urgent attention from the Provincial Department of Health as well as the district support partners in the province as well.
So, Ndivhuwo, unpack for us what those pressing issues are.
So particularly when we talk of ARV collection amongst people living with HIV, as Ritshidze, we found that more people could be using pickup points. We know that one strategy to actually reduce congestion at facilities is for people to go straight to a pickup point to collect their ARVs. However, our data is finding that 70% of people using facility pickup points tell us that they must still collect their files, they must still take vitals and see a clinician before getting their parcel. So this basically is an unnecessary delay when a person who's living with HIV can literally just go into the facility or the pickup point, get their parcel and leave.
Well, why do they need to check their vitals? I'm sure it certainly sounds from what you're saying that it's an integral part of a system, unless it's one of those things where you suggest that it isn't necessary.
So in most instances where people living with HIV are just going in to collect their medication specifically, there isn't a need to be taking out your file or taking those vitals unless you are going to consult because you're not feeling that well. So going in as a pickup point, and which is why we've also recommended that we have pickup points even in our communities and CBOs be involved in, being part of pickup points, external pickup points where people don't necessarily need to congest the facility, but rather they go to those pickup points to go collect their treatment and only go into the facility if they are feeling ill or they need to take their yearly viral load tests.
Now, this, if I recall, certainly from your report a couple of years ago, and this report indicates that certain populations, key populations such as gay, bisexuals, and other men, for instance, who use drugs, sex workers and trans people, continue to face challenges and discrimination. Is this something that you picked up, and how do you envision it being dealt with?
Again, this is an issue that we picked up, Hugo, and there were quite a few key populations who even came to the community meetings to express the kind of treatment that as key pops they faced in the facilities. We found that almost 4% of gay, bisexual and other men who have sex with men, as well as 20% of people who use drugs and 25% of sex workers and 21% of trans people who indicated that they had been denied services altogether because they were a key population. We had a sex worker who told us in a community video that due to her work and what she does, she gets to the facility and none of the healthcare providers want to even touch her and tell her that, you are working, so you must just go and buy your own condoms or whatever the case may be.
So is this a societal problem, or is it a problem specific to the area in which you conducted the report?
At this point, when we look at other provinces as well, we are finding that it could be a societal problem where healthcare providers may be bringing in their own beliefs and religions into work not considering that we do have key populations. We do have people who are trans who would like to go on HRT therapy, for example. And we found a lot of trans people who indicate that most of the healthcare workers are not really up to date or informed about all of these hormone processes and therapies and its services that trans people would need.
Now, the report underscores the importance of addressing these challenges to meet the 95-95 targets. How far are we from meeting those targets, certainly based on the outcomes of this report?
So in terms of us meeting the targets, we are a bit far off, especially when it comes to keeping people on care. In most instances, as Ritshidze, we found that a lot of the staff attitudes that people face in the facilities is what makes people to stop going and stop staying on treatment specifically. So if we can get and improve our healthcare facilities, if we can improve on staff attitudes, if we can work on our welcome back campaigns in the facilities, we can ensure that we keep and retain more people on care and on treatment in the country.
So elaborate on these welcome back campaigns that you speak of. How are they implemented, and whose responsibility is it to get these communities and certainly some of the workers that are welcoming back these patients into the health facilities?
So in most instances, we know that once you are on treatment as a person who's living with HIV, it's important to recognize that people living with HIV also live dynamic lives. They may miss appointments and may even miss taking pills once in a while. So in instances like that, the public healthcare system should meet people who have missed their appointments with support when they return to the clinic. So in Eastern Cape, we find that there is a stark improvement in people at the facility reporting that staff were always friendly and professional. So this is like up from 55%, from the 74% from last year. And it's instances where, as a person who's living with HIV, you may miss your appointment and you are either shouted at in the facility. We had a community member who said that in her clinic, you are publicly called a defaulter in front of everyone who's listening in the waiting area. And in those instances, you're also told to go to the end of the queue and you will be seen at the end of the day. If there were too many people in the facility, you're almost sent home and told to come back the next day as a form of a punishment to say that you missed your appointment and we're going to make you learn from that. Not realizing that people sometimes have to go to work. You can't get a day off from your employer because maybe you've not, told them your status, that you're living with HIV, so that is why you continuously need to go to the clinic and so on.
Ndivhuwo Rambau, Ritshidze Project Coordinator, unpacking that report for us on the Eastern Cape.